Hey guys, it's the Bougie Nurse and welcome back to my channel. I know I've been gone for a little bit, but your girl has a now 16-month-old baby. When I first started YouTube, I was ready, I was excited to share my knowledge. And then I found out I was pregnant, and then my morning sickness was really bad. Like, I was throwing up until about 20 weeks. So that's like half of my pregnancy. So I really didn't have the motivation to like get up and start recording, and editing takes time. So I literally just wanted to stay in bed all day. Little did I know, when she was born, that's a whole nother drama in itself. And she's like breastfeeding on demand. So, and I didn't necessarily have postpartum depression, but I just had postpartum blues. So I was not motivated to record and do YouTube. And anyway, nonetheless, I'm back. She's a little older now. She's a little bit more independent. I can just sit her down and have her in her playpen and let her do her own thing while I do my thing. So let's get into the video. And in this video, I'm going to talk about how to pass nursing school. So I get a lot of students DMing me on Instagram. My Instagram is @TheBougieNurse. And a lot of students say they're struggling. They don't know what to do. They're reading the textbook. They're following the PowerPoint. They just don't know what to do. So I'm going to let you guys in on tips that helped me while I was in nursing school. I wrote it all down. Okay, so the first thing you're going to want to do is figure out what your learning style is. We have visual learners, auditory learners, people who read and write. You also have your kinesthetic learners. So for my visual learners, I personally am a visual learner, and YouTube was my best friend throughout nursing school. So watch videos on whatever topic you're studying in class. So if I had to learn the 12 cranial nerves, I watched a YouTube video on the 12 cranial nerves. Your best friend when you're a visual learner is also going to be highlights and markers. Color code what you need to. Print out the PowerPoints, write all over the PowerPoint. I personally never bought a book. I either rented the book or I bought the PDF version and then I printed them out at the school, because my school has free printing. So I didn't print out the whole book. I just basically printed out certain chapters. I was able to write, highlight this, highlight that, and do whatever I needed to do in the book so the information can stick. I would take flashcards on my bathroom mirror. What I would have on these flashcards would be, let's say, vital sign range or your blood gas range. And every time you brush in your teeth in the morning, you're pretty much looking at it. And you brush your teeth twice a day, so that's 2 times a day. Some people brush their teeth after every time they finish eating. So that's 2 or more times a day that you're looking at something. And it's gonna stick, because you're gonna think during your test like, wait, when I was brushing my teeth, I remember seeing that tachycardia was 101 and over. Bradycardia was less than 60. Those who are auditory learners, maybe you can record the professor. I know some professors do not allow them to be recorded, and I'll be the first to say, I recorded my professor without them knowing, and I just didn't tell any of the students in my class either, because sometimes your nursing buddy can actually be a frenemy. Sorry to say. If you're gonna record your professor, ask for permission. If the answer is no, or they don't allow it, and that is how you learn, do what you gotta do. You're paying a lot of money for this school, whether you're paying out of pocket or taking out student loans. You gotta do what you gotta do to pass. Then you also have the people who read and write. This one is pretty simple. You just see the information and it sticks like that. I wish I had that. I don't. So basically all you have to do is read and reread, or write it out. You know, when you was in elementary school and your punishment would be, I will stop talking in class when the professor is talking, and write that 20 times so you remember not to do it. Yeah, so use that same concept in nursing school. If you need to learn the signs and symptoms of digoxin toxicity, write the signs and symptoms 30 times. And then that way when you're in class and you're taking the test, you'll remember, oh yeah, I remember writing down, what was it, the yellow halo? I'm sorry, I don't remember. Yellow halo or green halo, that's like the one that's like most pertinent. I remember writing down visual color disturbances. So That way, you know, you remember it. And then you have your kinesthetic learners. So basically, the kinesthetic learners are learners who learn by doing. So if you need to remember how to put on a blood pressure cuff appropriately, grab your cousin, your mom, your aunt, and practice putting on a blood pressure cuff on them. Or you can visualize yourself doing it, making it seem realistic, and that's how you will remember what you need to. Another thing I did in nursing school, I came up with mnemonic devices. Whatever topic we were studying that I had trouble with, I just came up with a song for it. For example, you go on YouTube, you look up "Thank You Next" instrumental, and whatever topic you're studying, let's say 12 cranial nerves, I'm gonna come up with a song for the 12 cranial nerves while using the "Thank You Next" beat. And I promise you, I ended pharmacology with an A because every time I took an exam, I was singing that song in my head. It worked. Topic number 2. You want to utilize your resources. Don't use too many resources. Don't have 4 or 5 different books, because although they are very similar, you can get information overload and you can become overwhelmed. Alright y'all, so my camera had died and my daughter is now awake. So you're gonna hear her making little noises and stuff in the background. You see the camera just moved, that's her. Very active. I'm just hoping. I know there were some nursing students that didn't look at the textbook at all, completely went out and got like a nursing made easy book, and you don't want to do that. You definitely want to utilize what is in your syllabus and the PowerPoints that the professor is providing, because many times professors will take certain information from the exact book. Say for example, page 52, line 20. One book might say BUN is 12 to 20. Another book might say BUN is 8 to 19. And then your actual school textbook might say BUN is 12 to 18. So you definitely want to go with your school's textbook, because that's what is going to be on the exam. Okay, within utilizing your resources, you also want to use your family and friends. Try to teach someone else, even if it's for pretend, even if there's no one next to you. Pretend that you're teaching someone, and I promise you the information is going to stick. When you're in clinicals, volunteer. If you have a patient, I know it can be very, very intimidating at first to interact with patients. I've been there. But talk to your nurses. Ask them, hey, if you have an IV insertion, if you have a Foley insertion, if you have an NG tube insertion. I went to nursing school in Florida and we're allowed to do NG tube insertion. I now work in New York and we are not allowed to do NG tube insertion. So learn your state and the laws and policies and procedures of your hospital and what is within your scope of practice. So volunteer, practice. Don't be afraid to make mistakes. That's how we learn. We learn from our mistakes. Obviously, you're a newbie. They know you're a newbie because you're shadowing a nurse. I remember the first time I did a Foley insertion, it was a peen. I cleaned it wrong, and the nurse that I was shadowing was like, no, that's not how you clean. Never make that mistake again. The best time to make the mistake is while you're a nursing student, because they're already expecting you to not know it. But when you're a nurse now and you're making a mistake, it's gonna be like, Alright, number 3, you definitely want to start studying early. Do not procrastinate, do not procrastinate, do not procrastinate. Procrastination is not our friend in nursing school. It does happen and it gets to the best of us, but you don't want to procrastinate. Have a plan of what you want to study. If you don't find time to study, you will less likely do well on the exam. Make a schedule and put a little time every day into studying. You'll feel less overwhelmed and you'll be able to retain a lot more information. If you study early, you're definitely preparing yourself for success. You cannot study a week's worth of information just on the weekend. Cramming is not your friend. I know there's some students who may say, oh, I cram every test and I pass every test. Show me the proof. Show me a video of you for the entire week not studying at all and just studying on the weekend and then doing well on the test. I personally don't believe that to be true. Before you begin studying, you definitely want to collect all your essential tools, your pens, your note cards, your books, your PowerPoints, your highlighters, your coffee, your wine. Just kidding, no wine. And the reason why you want to get everything and be prepared, because you are more likely to get distracted when you don't have all your necessary tools. When you go and get your laptop out of the living room, your brother is probably going to want you to come see some video on TikTok. And now we're watching TikTok videos and we didn't get any studying done for the day. Yeah, we don't want that. Put your mindset that, okay, I'm going to study. I'm going to put my phone on Do Not Disturb. I'm going to put my phone to charge in the living room and I'm going to be in the bedroom. So if a notification pop up on my phone, I'm not going to be tempted to look at it. Okay. All right, number 4, you want to study Brooklyn Chronicles. All right, number 4, just to piggyback off of what I said previously, you want to try to possibly study outside your environment, outside of your home. You know, your roommates might distract you, your family might distract you. So if you can study at the school library or maybe at a coffee shop, because studying in the house may not always be the best fit for you. You want to start studying early. Have a plan of what you want to study and what you're going to look over. Definitely do NCLEX style questions every single day. I believe I said this in a previous video. Really want to focus on doing NCLEX style questions every day, because that is what's going to prepare you for NCLEX. Number 1, we want to pass the NCLEX, and number 2, that's what's going to really help you pass nursing school, because you're going to learn how the questions are formatted during the test. High blood pressure, NCLEX style question. ABG, NCLEX style questions. A lot of the times you're going to see the questions are similar. They may be worded differently, like one number might be off. It might be patient named Sally instead of patient named Mary, but it's really the same concept. And that's really what's going to prepare you for passing your nursing school exam. Do not look at new material the night before or the day of the exam. So on Monday through Thursday, you might look up modifiable risk factors of stroke. And then on Friday morning before the exam, you look up non-modifiable risk factors of stroke. That will confuse you because you are not consistently looking up the same information every day. And these professors like to, you know, throw a little trick. Examples of risk factors of stroke include what? Smoking, diabetes, diet, hypertension. And then the professor might throw in family history. Family history is not a modifiable predisposition, right? But because you looked up the information right before the exam or the night before the exam, you might think, I think I've seen that under the modifiable ones. And you might select that one, and that makes your whole answer wrong. Be consistent with the information you're studying every day. Alright, so number 5, you want to remain positive. You want to have positive thoughts. You want to be around positive energy. Even if you don't think you did well, remain positive. You want to say positive affirmations. You want to visualize success. You want to focus on the light at the end of the tunnel. Yes, nursing school is hard, nursing school is difficult, and you are going to have your days where you can't be positive because you just failed this exam, or you just got some bad news because you're juggling nursing school and you're juggling your personal life. But if you can stay more positive than negative, that will definitely aid in your success throughout nursing school. Having that good sense of humor, I'm telling you, that's what's kept me sane. Alright, y'all, I think I'm up to number 6. I literally have lost count. You want to have critical thinking skills throughout nursing school. When you look at the question, you want to ask yourself, should I be memorizing this or should I be comprehending it? Because there's two different things. There are certain things you are just going to memorize, like lab values, side effects of certain medications. Those have to be memorized. But when it comes to Why is this patient on dialysis? That is something you have to comprehend. You have to understand, okay, the kidneys failed and the body is no longer able to waste this excess salt water and blood. So now this person has to get dialysis. That is something you cannot memorize. That's just something you have to read and understand. Along with critical thinking, do not second guess yourself. The first option you chose is correct. Always go with your gut feeling. Unless you absolutely sure in your heart, in your mind that, you know what, I'm gonna change this answer because I, in my soul, believe this is the right answer as opposed to the original one I chose, then you can change your answer. But please, 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 do not second guess yourself. Do not change your answer. All right, number 7. Study in a group if you can. I definitely, if you can and if it's beneficial for you, I would recommend group studying. It's not necessary, but it's definitely helpful to bounce off ideas off of each other. For me personally, I studied with a group almost every semester. Not every study session was with a group, but at least once a week you can quiz each other, and if there's something you don't understand, someone can break it down in a different way where you can understand it, or vice versa. You could break it down for them so they can understand it, and you're just building relationships and helping each other. Writing solo throughout nursing school, maybe that might work for you, maybe it may not. I mean, group studying may work for you, it may not. You just gotta try it and see. Number 8, want to make a schedule for yourself. You want to get a planner and plan out your day every day. Have a daily schedule. Okay, what am I going to do today? Am I going to look up YouTube videos? Am I going to study for this quiz that's coming up? Am I going to watch TV? Am I going to hang out with my friends? You definitely want to have a schedule, which is going to help you prioritize your day and what needs to get done. Within this schedule, you also want to write in important dates. What day is this care plan due? What day is my quiz coming up? What day is the exam coming up? What day do I have ATI or T's? What day do I have clinicals? What time do I have to be at clinicals? What time does clinical end? And write everything down to the T. This will help you remain organized. It will help you not get overwhelmed. You can plan out your future. On this day, I don't have anything that's due. So maybe I'll take this day to hang out with my friends, call my grandmother, check in on my cousin. You definitely have to incorporate some sort of social life within your nursing school journey. Alright y'all, so that's a wrap. I hope you guys enjoyed the video. Remember, making A's don't make great nurses, but it's definitely important to aim high. Good grades are important for when you want to go back to school, whether it's to advance your career, get your master's, whatever the case may be for you. Many great nurses fail an exam or two, so don't get discouraged if that does happen. Just bounce back, dust it off, and try again. Thank you guys for watching. I hope you stay tuned. Thank you for coming back. I'll be putting out weekly videos, so stay tuned for that. Give your girl a thumbs up, subscribe, share, all that good stuff. Alright, and I'll see you guys in the next video. Thank you.
Hi.
Oh.